I have always been pretty active, and probably 2 years ago, I started having some pretty substantial pain in my groin area. And at first I thought I had pulled a muscle or torn something playing tennis. Uh, and ultimately, I went to see my internist, and he sent me for some x-rays, and they said I had osteoarthritis in the hip. When I first decided to have the surgery, I was down in Florida, and I sort of thought about where I wanted to have the surgery. Now, there's lots of orthopedic surgeons in Florida, and I wanted to, like a lot of other things, I researched it. I'm sort of a researcher. And so I went on the internet and read about hip surgery and thought about where I wanted to have the surgery. And I considered having it in Florida. I considered going to one of the major hospitals in Boston, Brigham and Women's or Mass General. I considered the Hospital for Special Surgery in New York. And ultimately, I came to the conclusion that the place to have it, if it was going to work out for me, was DHMC, because number one, I think it's an outstanding place. Number two, it was close to home, and I have family in the area. But I think when you get to my age, most people, myself included, know people who went into the hospital for a routine procedure and it didn't turn out to be quite so routine. I looked at the infection rates for various hospitals, including DHMC. I looked at the information, all the information I could find about the surgeons, not only on the DHMC website, but on Google. And I think that I looked at records from New Hampshire in terms of complaints or problems about the various surgeons. And I did that not only for DHMC, but for the other places I was considering looking at. I sort of ultimately came to the conclusion that if there was a problem, and obviously none of us want there to be a problem, but if there was going to be a problem, DHMC was the place I wanted to be. One of the things that my research indicated, as well as talking, I must have talked to 10 or 12 people who had had hip surgery at various places, Boston, New York, Florida. One of the things I learned was that there was a relatively new way of performing hip surgery called the anterior approach. And that involves making the incision, as I understand it, making the incision closer to the front of the hip while the patient is lying on their back. And in order to accomplish that, it requires, as I understand it, a special table called the Hanna table, which involves the patient lying on their back and also allows the surgeon, once the patient is anesthetized, to manipulate the leg so as to expose the joint. The benefit of the anterior approach, as I understand it, is that there is much less cutting of tissue and tendon, the result of which is that the patient recovers more quickly, and during the early stages of recovery, there's less chance of dislocation of the hip. I was determined that I was going to have my hip replaced using that procedure. One of the issues with the anterior approach, which we've been talking about, is that not everybody is a candidate for that method of hip surgery. and as I think Dr. Cantor, who I think a good bit of, but is also, I think, an academic as well as a practicing surgeon, made the point with me that there's really no valid scientific studies that would show that the anterior approach is better. All we have is this anecdotal stuff, but what we don't know is whether the universe of patients who've had that type procedure is consistent with the universe of patients who have the other procedure. Everything about the experience, from beginning to end, favorably exceeded my expectations. I thought that the pre-surgery procedures were well explained. I thought they made sense. They had a orientation class on what to expect. When I went in for the various pre-surgical checks, I thought everybody was helpful and understanding. On the day of the surgery, that same day surgery operation is very efficient, very helpful. I was amazed at, I guess, the fact that although I think, informed enough to understand that hip replacement is a relatively routine procedure. They do hundreds of them at DHMC. And compared to all of the surgical procedures they're doing at DHMC on a daily basis, replacing one hip for me was routine. And yet, from the entire time I was there, no one ever treated me as if it was routine. The entire culture of the people I came into contact was as if I was the most important patient in the world. I was amazed at the lack, or I won't say lack, the minimal amount of pain. I think I was done with the surgery, they tell me, at 2:30 on a Monday afternoon. By 9 o'clock that night, the nurses had me taking a few steps with the walker. Tuesday morning, which is less than 24 hours after the surgery, they stopped the morphine or morphine equivalent drip, and I had one prescription painkiller, and that was it. I did not have another prescription painkiller. They gave me a prescription for it, but I didn't need it. I existed on, not existed, but did very well on Tylenol for a couple weeks and then stopped that. And I went home on Wednesday. The surgery was on Monday. I never used crutches. I used a walker in my house a little bit for balance, although I only used that for a couple of days. And then I used a cane for maybe a week, again for balance, not for any kind of physical support. I was doing stairs, I think about 10 days after I got home. And I was walking on uneven ground outside 2 weeks after I got home. And I would, by 4 weeks after the surgery, I was walking about 1.5 miles on a walking trail. I started playing golf I started hitting golf balls about 6 weeks after the surgery, and probably was playing not real well. Maybe 7 weeks after the surgery, I'm now playing pretty well, and walking 18 holes, playing and walking 18 holes with my bag. I feel terrific. I have no pain. I sleep at night. I can walk with no pain. it's just 100% improvement.